Michelle Norris, welcome to the
Hey,
Aging and Grace podcast. I'm really happy to have you on.
thank you. It's an honor to be on. I'm excited about your new series.
Well, thank you. Thank you for that. I'm very excited too. Um, for I found out that the best way to learn is to talk to people, right?
Hmm.
Who know things. I do read and I do watch podcasts, but just having someone that I can talk to one on one naturally is just the best way for me to learn. Um, So, and you are a person who has a lot to teach folks who I know you are very passionate about affordable housing, so we'll spend a lot of time on that. But you have 30 years plus 1 month experience with with National Church residences. Um, Now, I was looking at your LinkedIn, and clearly, this was not a passing passion of yours when you started.
Yeah.
So tell me a little bit of the background of what kind of a person would like spend 30 years doing such significant and meaningful work. And it feels like you, I think we spoke before, it feels like you knew that this was really what you want to do in terms of
Yeah.
contributing to, you know, to your society and humanity at large. But tell me, how did you get into this passion?
Wow. Well, you don't have all day, so I'll try to give you the shorter version. So I guess for me, it was one of those things where all my worlds kind of collided into a place where everything kind of made sense.
Hmm.
So when I was growing up, I grew up through a church that was very much spoke to look for places where your mission, your conviction, your faith could also be integrated into your workspace. And so I kind of wandered a little bit. I started out actually my degree was in teaching. I was going to be a secondary education teacher. And but though that didn't work out, and that was partly because the market way back when, they had so many teachers, I couldn't even find a job. And so because of that, I started wandering into the business space and found a couple of different opportunities, and I kept trying to figure out, do I feel like this really aligns with my faith and my heart, and can I get passionate about it? And then lo and behold, I answered a blind ad in about an organization that I'd never heard of. And it turned out that it was National Church Residences, which was my alma mater, so to speak, for 30 years, as you mentioned. And when I walked in the door, everybody had a business card that said compassion with professionalism. And I thought, look, if this place is truly lives that motto, I really want to be some place where I can continue to grow my professional skills. But I want to be in a place where the compassion matches my faith system. And that's really, I walked in the door, I'm like, wow, this feels like it could really be that place. On top of that, the funny thing is there's four churches that founded National Church Residences. And I had been attending one of those churches for like the last 8 years and had never heard of National Church.
Wow.
I know. I was like, our marketing to the churches, to the founding
I was gonna
churches
say
need to
that.
get improved.
You got to use those channels, yeah.
So, well, I was just where I was in the space of my church. I was in small groups and
Sure.
stuff, and I was never on session or something like that. Anyway, so fast forward to just like a year later, I was really in the accounting side. I was director of accounting.
Hmm.
And so I loved the organization, but I really knew that accounting had been where I'd been making my bread and butter as professionally, but it didn't excite me very much still. But my boss told me, he said, if you really want to be good at what you're doing, even in the accounting side, you need to go out and understand what we do.
Hmm.
So go see the properties, go visit residents, go visit our staff. So it just so happened that there was one of our properties on my way to see my grandmother, who was one of my favorite people in the whole world. So I stopped at this place randomly. I called them and they said the manager's not there, but the backup manager, who's one of the residents, is there. I meet this lady. She's adorable. She's smart and just really engaging. We have this conversation. She's about 40 minutes away from where my grandmother lives. And she turned out to have grown up in that same town. And I said, "You don't by any chance know Sylvia Rife?" And she says, "Oh my gosh, she's one of my best friends. We've been in Sunday school together for like 20 years." And I'm like, okay, so this is clearly a place where all of me is all integrated. And then, so what I would say about housing is the how we do the mission that we do. And that was for me why I got so engaged in the affordable housing once I was there. Like, I want to know everything about how affordable housing works with older adults, because I have one of my grandma's best friends living in one of our housing communities. So that's kind of,
That's
hopefully
wonderful.
that wasn't too long, but
No, that's fantastic. And so that piece of advice, go and, look at, visit the properties as opposed to think about them as, rows in a spreadsheet.
yeah,
I think that was great advice. I
it
wish,
was.
and great advice for anyone who's doing business, is go to the
Mm-hmm,
field, talk to the customer, so to speak, or go and understand it viscerally.
mm-hmm,
That was great advice. I wish more people would do that. I mean, in my business I do that, and now every time I go, I learn so much, and
yeah.
I look back at myself before that and I say I was so naive and so arrogant, and then you keep learning though, right? You keep learning every single
That's
time
right.
you learn something new. So um, affordable housing. I was looking this morning at what is it called? The Maslow pyramid,
Yeah,
right?
right.
At the very, very
Mm-hmm,
bottom, it's food
mm-hmm.
physiology. And just above that is safety, right?
Yes.
Security. It's basically a fundamental thing to be housed. There's so many, and we talked about this before, you and I, so many things become extremely difficult if you don't have secure housing.
Mm-hmm,
Job, school, you know, raising children,
mm-hmm,
keeping a relationship going. Um, and so, and my question to you, and sort of this is like a paradox, is the following. Um, this nation is so rich, right? We are so rich and blessed,
mm-hmm,
and yet we continue to have basic problems at the bottom of the Maslow pyramid. I mean, we should be having
mm-hmm.
problems about, okay, are people fulfilling themselves, and are they doing exactly
Right.
what they want to do, and so on. But we remain struggling with that. Question one, since you have a span of years where you've been able to see change, have things gotten better or worse when it comes to affordable housing in general? And then more specifically, to the extent that you, I guess you do know, regarding senior housing, do you think has
Mm-hmm.
it gotten worse or better, or remains the same in your opinion?
Yeah. Well, I would say statistic or the data would say it's getting worse. We are definitely in a shortage that is a growing shortage. So the number of people that do not have safe, decent, affordable housing as a percentage of the whole population has grown. That's kind of the negative side. I will say on the positive side, the half full side, affordable housing is the topic today everywhere at all levels of government, federal, state, local. It is an awareness that the public has because more and more people are finding that they just can't afford, whether it's they can't buy a house, they can't afford rent. It's eating too much of their income. So because it's really so acute on the real side, you're also seeing more public awareness about we've got to fix this. Um, that being said, no fix is going to happen tomorrow.
Yeah.
So I really do believe it's today more acute than it's been. And you also see that around the homeless issue. So as we talk about things being unaffordable, you also find people that end up in homeless situations for reasons that we used to not see as much. And one of those is older adults. So
Mhm.
I currently am chairing the Corporation for Supportive Housing, which is an organization that is a lender and also an advocate around solutions to homelessness and housing first models. And we, at that level and also in other places, are seeing that one of the fastest growing segments of the population becoming homeless is older adults, those over 55, and that happening for the first time after they're 55. So think about that. Somebody is 55, they've never been homeless. That means they've probably had a job. They have
Yeah.
most likely been living maybe not a great, like super high income life, but they've been really operating in what we would just call normal America. And suddenly something happens, like they have a health event. They don't have Medicare yet,
Mm.
right? So they have a health event. They suddenly have medical debts. They've lost their job. I know somebody who that happened to. Became homeless for the first time after 55 because of a back injury, lost his job.
Oh.
And so we're seeing more of that, the safety net for these for people like that, and because we are as a country getting older. So
Mhm.
we do have more people in that really vulnerable stage of life where their vocation maybe has made their health harder, and yet they're not in the safety net era.
Yeah.
They're not in the Social Security draw. They're not in a Medicare level. That's 65, 70. So yes, so to your point, yes, I think affordable housing for all segments, and in my space, definitely around older adults, it's an acute crisis that we're just beginning to try to respond to.
Yeah. Well, why do you think that things have gotten worse, given the premise that I started with? Well, I think the fact that we are a much richer nation now than we were, say, 30 years ago, 40 years ago. Um, and I think it's true that well, you said this for the first time, folks who are older, between that in that pocket of
Mhm.
vulnerability, are becoming homeless, whereas before they didn't. Well, how come? I mean, people injured their back before, right? And we were not so,
Right.
right? Well, how
Yeah.
come? Well, we didn't have this before. In your opinion, what are the main sort of? I know there's a million of them. Main sort of.
Yeah. There are, like you said, there are a million of them. Maybe not a million, but there are a lot of them.
Lots of, yeah.
Obviously we are an aging population, so that's clearly we're going to see more older adults having stress because we're an aging population. We also know that net worth for older adults is incredibly divided. There are some very, very high net worth older adults. There are some incredibly low net worth older adults. And they're in that space again where the safety net programs are not out there yet, right? If you're 55 to 65, you're very vulnerable.
Yeah.
And then on top of that, clearly this housing shortage, you can talk all day long about the stats, you can talk about the immigration status, you can talk about a lot of stuff, but everywhere you look where cities have high homelessness, you also have real high pressures on affordable housing, just not enough stock, and therefore rents are high, and it's pricing people out of housing. So, like I said, you're seeing some encouraging signs across all levels of government trying to address the supply problem. And I think in the end, most of it is a supply problem.
Mm, really? Okay. What do you mean, like supply? We don't have enough units out there? Is that?
Don't have enough units. That's right. I live in Columbus, Ohio, and we're one of the fastest growing cities in the country. And, that's a very exciting thing until you think about people that are moving here for jobs, but then can't find a decent place that's affordable. So we're growing our job market, but we have to try to keep up with the supply to address that growing job market. And no housing gets built in a year,
Mm-hmm. How come?
right? If you've got 2,000 people come in for new jobs,
Yeah.
a housing apartment is 200 units, especially in affordable. And affordable housing takes quite a while to build.
Yeah, yeah. I mean, is there money in affordable housing? I mean, this is a capitalist system, right? And people go and build, these luxury things where they can. I mean, I've heard folks saying, "I'm not going to do that because there's not money. There's no money in it," right? Do you think it's because of that, like, or, or is it? Let me give you throw another thing at you, which is like, for example, Seattle, and San Francisco, right, are no longer affordable.
Mhm.
The the let's call the indigenous population, the people who used to live there, can no longer afford to live there, and so they have to go to the suburbs or go to whatever, right? Or even transplant themselves to some other city.
Mhm.
And so, the supply is there, right? But there's an influx of people from Amazon and Boeing and all those people who have a lot of money. All of a sudden, they displace and they gentrify and so forth. Is that part of the equation, do you think? Is it part of the many, many things that I guess that I was thinking perhaps could be contributing to this?
Yeah, I think there is some truth to equilibrium, right?
Mm,
On a
mm,
very local level, that you're always going to have these equilibrium imbalances. But when you look at the whole aggregated system, there's no question that we don't have enough
mm,
stock
mm,
overall. So, again, you have acute little situations. And like in Ohio, we have a lot of rural towns. So it's like, well, gosh, why don't those people just go to rural America where it's a little bit cheaper
mm.
to live? Well, it's cheaper to live, but your wages are also a lot cheaper. So the gap, even in rural America, between what you can afford and what you make is just as much a gap, or is also a gap, just like it is
Yeah,
in the city,
yeah,
because it's higher wages, but higher rents, lower wages, lower rents, but they're all having gaps. And there's a great report out there that has now escaped me in terms of what the name of it is, but Out of Reach, which is a really good report that shows this data-driven reality.
Um, give me a couple more of these drivers. In terms of, so you have supply, what would be the next big thing there?
Um, well, I would say that on certain markets, as you mentioned, it is that certain markets are even more acute because of growth, like job growth or industry growth. I mean,
Mm,
obviously, California is just craziness. Nothing, no offense to California, but goodness gracious, they have a real housing problem, and a lot of that, right, is it's tech boom. So when you have a boom, you have a lot of people rush to jobs. And so you do have migration patterns that will definitely contribute to some of those, some of that issue. But you asked earlier about like, are there programs that can help build this?
yeah.
There are obviously, and given my length how long I've been in the business, I've certainly seen those programs migrate and change and morph over the years. But today, the most common program is called the Low Income Housing Tax Credit Program, which is how housing gets built on a regulated basis. So if you want to build affordable housing, most likely you're going to use that program, which is a federal program but administered by the states. And in the recent bill that was passed in July, they did actually increase on a permanent basis the amount of capacity that program will produce. So again, that's a really good
Yeah.
news, and it is driven by just private developers, whether that's for-profit developers or nonprofit developers. So they actually are the ones that execute this program. So
Yeah.
over time, look, in 5 years, is that going to make a really big impact? Probably, but that's 5 years from now.
Yeah.
So again, we've got the problem, we're looking towards solutions, but it's going to be we got ourselves into this over decades, and it's going to take decades to get out of it.
Yeah. Um, Let me take a step back. Tell me about National Church Residences. What is their mission? Um, because I think there are other associations also that are faith-based. What do they have in
Mhm.
common? Well, tell me first about the the church residences, national church residences, and then I think there's Methodist. I think there is something Methodist or
Oh, they were Presbyterian. Yeah.
Presbyterian.
Yes.
Right. Okay.
Yeah.
So tell me about the organization, if you could.
Yeah. So it was formed in 1961, and it was founded by a pastor of one of the four churches that ended up being the founding churches. Turns out he was originally the pastor of the church I went to for about a decade. Anyway, so he founded this organization by basically founding one campus that was a continuing care retirement community in Ohio, in Southern Ohio. And over the years, so just think about it, that was one campus. And now they have about 350 campuses. Plus, they really serve the full continuum of care for older adults. I know that you're very familiar with the service coordination program. National Church Residence is one of the largest service coordinator programs in the whole country. They have assisted living communities, they have skilled nursing facilities, they have home health care, they have primary care. So if you think about anything an older adult might need to carry them through their journey of getting older, National Church Residences over the years continue to grow as an organization and try to find ways to address those needs. And so it's quite diverse in terms of how it does that. And it's very large owner of real estate as well. And it's got a terrific skill set of folks that do the development as well as manage. They do property management. So, and it's stayed true to its mission. Its mission really was founded around providing housing and health care for older adults. How does it, you asked about how is it similar? Are there other organizations that were also very faith-based organizations like National Church Residences? A couple of them, there's a group called Retirement Housing Foundation in California. There's Mercy Housing that's based out of Denver, Colorado. There's Volunteers of America that is based out of DC. All of those organizations were kind of sister organizations that were founded in the early days of affordable housing, partnering with the government.
And they are all nonprofit, I'm assuming.
All nonprofits, yeah.
Yeah.
And they all do great work. Most of them have service coordination in their programs. Most of them have done, the continuum where they work with not only affordable housing, but also the services that older adults need.
So I found out or learned, I'm new to this space about a year or so, 2 years, I would say, 2 years of just doing a lot of research, and because my business is in it. So like you said, you need to know, who are the folks who can, you can help and so on. Now, I learned that the churn rate, meaning the churn rate in terms of the staff is high for service coordinators. As an industry in general. Do you think that first of all, do you agree that that is a problem? Number one. Number two, do you think that problem is more acute in, say, for example, I don't know, the privately held for-profit organizations versus the nonprofit ones? Or do you think it is prevalent across the board? And if you agree with that, what do you think the causes are?
Well, I look at service coordinator as part of a group. So there's service coordinators who really are pretty unique that work inside affordable housing. But you equate that often to outside of housing, we have home health and hospice, people that go into people's houses, home care aides. So across the board, first of all, it's intense work. You're really providing great care, and often you're replacing family members. And all of those roles, you could be essentially the only person somebody sees all day. So it's hard, it's high work, high mission work. But to be very honest, it's very similar to school teachers. I just don't think we pay people enough. We're asking them to do really good, hard work, and yet we don't pay them well. And all those groups, I would say that's true. And so we do know that we do have higher turnover rates as an industry. And in the end, I think two things that would help. One is better wages. And the other one is starting to use technology to make people's jobs better. because we don't have enough workers, and that's not going to get fixed.
Well, yeah, exactly. Well, I mean, technology can only go so far because this is such, um, and then, it's the context requires the human touch much more than,
Yes.
so you cannot replace, obviously, right?
Hmm.
I mean, you can reduce a little bit, or at least make the pressures on them a lot less than otherwise. You don't have to just run around doing a million things. Do you think there is a strategy? Because I mean, technology is now becoming crazy good in terms of the things. Of course, there are dangers and everything, but one
Hmm.
has to acknowledge that one can do many things now efficiently. Do you see a strategy emerging like deliberately from organizations like yours that are saying, okay, well, let's take a step back. Let's understand what's out there in terms of technology, what the future, brings. I mean, these AI, companies are just creating amazingly crazy stuff,
Hmm.
good and bad, tools that are powerful. Do you see companies like yours sitting down, or organizations like yours sitting down and thinking through, strategically, how do we address these critically strategic problems like shortage of help helpers, and service coordinators, and then align that with potential technologies out there to enable the delivery of excellence, retain those folks that are so precious in this human-centric environment, and do it obviously efficiently and in a way that scales. Is there, a sort of a strategic thinking, in your opinion, happening?
Yeah. Well, first of all, I left in full employment from National Church
Yes.
Residences,
Oh,
as
sorry.
you
Yeah.
know, a year
Yes.
and a half ago. So I can only speak to
Yes.
more the
Yes.
broader perspective at this
Of
point.
course.
So,
Sorry. Yep.
I've been now consulting with National Church Residences and several other organizations, and not all the same. I've been working with a state agency. I've been working with a healthcare plan. I've worked with a developer of housing. So what I see across all of them is that we really are struggling with trying to keep up with what I would call today's
Mm.
opportunities. And let me give you a great example since we were talking about service coordinators. If it were me and I could wave my magic wand to those four organizations that I just mentioned, that were all basically doing amazing amount of really good work of affordable housing for older adults, that would be VOA, Mercy, RHF, and National Church Residences. I would figure out some way to get every one of their buildings, first of all, to be internet accessible through every part of the building.
I mean, you shared with me a statistic, which was like what's the percentage of folks who don't have Wi-Fi or internet?
Yeah, probably like more as we've looked at data sets across there have been various data sets, but it's somewhere 50% or less of
Wow.
people that have it in their homes.
Yeah. Wow. Okay.
Because, and the reason is the buildings don't have free Wi-Fi
Yeah.
like you would think in many apartments. Well, it's not free in many apartments. They just build it into your rent.
Sure.
But in affordable housing, that business model doesn't work for a variety of reasons. So it's not free Wi-Fi. The buildings aren't even set up to do it if they wanted to.
Yeah.
And then so the residents are paying direct to the ISP provider. And that
Sure.
is, as you know, 70, 80,
A lot
$90
of
a
money.
month.
It's a
How
lot of
many
money.
people that are living on a fixed income can do that?
And yet,
So,
can they afford not to be connected, right? That's the
well, they
thing.
are not connected.
I'm saying it's getting close to becoming like electricity, right? There's so much so many problems become magnified if you don't have. But
Absolutely,
go ahead. I'm
absolutely.
sorry.
So,
Yeah.
so the buildings themselves, and also there's to that point, there's another example of that, which is in rural America, which they're really elevating from the healthcare perspective, that the only way to really do decent healthcare in rural America is that we have to get people connected to the internet.
Yeah.
So anyway, to your point, that's exactly right. I would say internet or internet access is healthcare access, pure and simple. In today's world, internet access equals healthcare access. And we don't have that in affordable housing as a standard of practice yet. So I would start there with everybody, say, you've got to figure out ways to get the building so that you have internet access inside people's apartments, that they can afford, either that it's free or it's affordable.
Yeah.
From that point, then the other part is service coordinators, as I know you are very familiar with them. They are still running on a pretty 25-year-old model. It
Mm,
was driven out of a HUD program. And so if you think about really this being a non-clinical approach to helping people age in their homes, you still have to do records. You still want to do searches for services. And often, and I'm not speaking about any particular provider, but there are providers where those staff are either doing things on paper and then going down to an office somewhere and trying to put it into a computer,
yeah. Yeah.
right?
They come
So if
into a
you think about,
process. Yeah. Yeah.
yeah, so it's one of those that I feel is absolutely ripe for using AI and better technology, to really help change the model and make it better. And maybe then, to your point earlier, the turnover could also go down because suddenly
Yeah.
you feel like you're really focusing because you've got a tool that helps you.
What's interesting is the sort of it's like a vicious cycle, right? So you come in and you're thrown into the process as it is now, and so you're just busy, just doing things as they are now. You have no time to or bandwidth or mood to
Yeah,
reflect on. Well, let me change things so that I can do. And then before you know it, you're exhausted and you're out. And then the next thing,
right.
right? So it's sort of like if you introduce if you you know that loop has to be broken somehow, and that's what I was thinking about strategy, our folks thinking strategically, because it has to come from upstairs, right? The folks
It
in the
does.
front
It
line
does.
are just way too busy to just
Hmm.
stay above water now.
Hmm.
Wow, okay, so we're almost done. I think we should have said an hour because I have so many questions, but in any case, let me ask you this. If you had the power to pass one legislation, because I know you have done legislative work and so forth. If you had the power to pass one legislation that you believe would be consequential, would have amazing ripple effect across the board, and it would just start a virtuous chain of good things happening, what would it be? Again, assume you have that magic wand.
Well, what's the problem I'm trying to solve?
I mean, one piece of legislation that you think is strategically, if you pass it, that's going to make a lot of good things happen as a consequence.
Oh,
Tough
gosh,
question.
I think my strategic piece of legislation would be that that they force more bipartisan policies to go through. To be very honest, I feel like I've seen a lot of good ideas come on from both sides of the aisle, but right now it's so hard to get anything done because everything kind of gets stuck in some of this, you
Well,
know.
assume there's like we're living in a la la land and there's bipartisanship, right?
Oh, okay. Well,
Yeah.
if we've already fixed that piece, well,
Yes.
okay. All right. So if we've already fixed that piece, um, then I would say it would have to be something where, because this is probably just a passion of mine, that there is a forced integration between HHS and HUD
Mm,
that allows us to look at integrated models of providing service-enriched housing, for vulnerable populations. Because HHS is already on the front end of telehealth and technology,
mm,
and HUD's holding all those people in their housing.
yeah.
And to me, they are so siloed.
Yeah.
And if there was a legislation that forced them to do an integrated, future looking IT or technology driven service enriched housing, we could change things.
Wow. Yeah. I mean, that's a great idea, actually. Because I mean, there's so much left on the table by them not coordinating with each other,
Mm-hmm.
and so many
Yeah.
problems that they have to deal with would disappear like magic if they were. Um,
But to your point, exactly the same problem happens in government that happens in organizations.
Mm.
It has to come from the top. Because
Yeah.
everybody in the field, especially now, we have a lot fewer people in the field of any of the government agencies. They're just trying to process what the
Yeah.
work that's in front of them. So we need really strategic, smart thinkers at the top saying, how do we do things different, and more integrated, and take advantage of what's currently here today around transformation through technology.
Yeah. Well, I mean, right now you are an advisor to various companies. You're talking to people with big heads and big pockets and so forth. Maybe maybe you can let them know that, hey, start thinking about, the next 5 years. Because as you said, right,
Yeah,
the capacity is making its way, right? It's growing. And with capacity, there will be new good problems to have, right? Which is
yeah.
how do we make sure these folks are connected? How do we make sure that they are that we retain um, the staff and so forth. Michelle Norris, let's mention the name of your company, Insight. How do you
Oh, yeah. It's Insights
Insight?
Consulting, which
That's
N for Norris. So N dash sites,
very, very,
Insights.
very,
Yeah. Yep.
very
Insights
clever.
Consulting.
Love
Thank
the name.
you. Thank you.
Insights Consulting. Thank you so much for the education. I look forward to speaking with you some more. I know we will come back and ask some additional questions. Maybe we can do another episode in the future. But Michelle,
Love it.
thank you so much for your
Have a great
time.
day.
Take
All
care.
right. Take care.